One of my favorite memories from childhood? Petting zoos. Who am I kidding? Petting zoos are fun regardless of age. This one, though, this one is world-renowned for its narcoleptic planking goats. Come take a look and learn about two treatment options for narcolepsy, armodafinil and modafinil. Let our excessively sleepy goats remind you of narcolepsy, a disorder that results in excessive daytime sleepiness due to the brain's inability to properly regulate wakefulness and sleep. I said petting zoos are fun for all ages. Not if you've been here all day. This parent looks excessively tired, right? Excessive daytime sleepiness is the uncontrollable urge to sleep and occurs most frequently in monotonous or boring situations. Maybe our parent is a little bored of the planking goat? Impossible, no. Some other symptoms of narcolepsy include automatic behaviors to avoid sleep, disrupted nighttime sleep, sleep paralysis, and hallucinations. Like our one-horned and two-horned goats, there are two types of narcolepsy. Narcolepsy type 1, or NT1, is associated with cataplexy, the sudden loss of muscle tone. Narcolepsy type 1 was formerly referred to as narcolepsy with cataplexy. Let our one-horned goat and her cataplectic feline friend symbolize narcolepsy 1, narcolepsy with cataplexy. Although narcolepsy type 1 does not require cataplexy to have occurred for a diagnosis to be made. A diagnosis of narcolepsy type 1 can also be diagnosed based on low orexin, so let our low orex here symbolize low orexin with narcolepsy type 1. Orexin, also known as hypocretin 1, is a neuropeptide that helps regulate arousal and wakefulness. A loss of neurons that help make orexin is a causative factor for narcolepsy type 1, which may result from a combination of autoimmune activity and environmental triggers. It's also been found that around 98% of people with narcolepsy type 1 carry a gene variant known as DQB10602, which has been widely regarded as a likely factor that would make someone susceptible to developing the condition. It's also important to note that patients who have not experienced cataplexy but have low levels of orexin are likely to develop cataplexy in the future. And our two-horned, standing, or could we say non-cataplectic goat. Narcolepsy type 2 is narcolepsy where cataplexy or low orexin levels are not present. If patients go on to develop cataplexy or low orexin levels, their diagnosis can be reclassified to type 1, which occurs in approximately 1 in 10 cases. Look, we didn't come here just to see the goats, though I'd be totally okay if we did. This zoo has other animals to fawn over. Let our armadillo and Mo the giraffe symbolize armodafinil and modafinil, two treatments used to promote wakefulness in patients with excessive sleepiness associated with narcolepsy, as well as obstructive sleep apnea and shift work disorder. Now that is a draw card. An armadillo with an R-shaped tail. Well, armodafinil is the R enantiomer of modafinil, which is a mixture of both R and S modafinil. The mechanism by which armodafinil and modafinil promote wakefulness is unknown. The wake-promoting actions of armodafinil and modafinil are similar to sympathomimetics, like amphetamine and methylphenidate, but they do not exert their actions in the same way. A wrangling dopamine rope. Recall that our recurring sketchy symbol for dopamine is a rope. Armodafinil is an indirect dopamine receptor agonist, and both armodafinil and modafinil bind to the dopamine transporter and inhibit dopamine reuptake in vitro. Yet, interestingly, the wake-promoting actions of modafinil are not affected by dopamine antagonism by haloperidol in rats, and its locomotor activity is not affected by co-administration with a dopamine synthesis inhibitor. Along with wakefulness, armodafinil and modafinil produce a range of effects that are typical of other CNS stimulants, including euphoria. Just look at this euphoric crocodile wrangler.
Wild, mate! Oh, look at it! It's a beauty!
As well as alterations in mood, perception, and thinking. Because of these effects and reinforcing properties, these drugs are liable to abuse and diversion. Armodafinil may be preferred over modafinil due to its longer half-life, being 3 times longer than the S enantiomer of modafinil, potentially translating to more effective promotion of wakefulness. This longest-living armadillo brings crowds from afar. Whilst there are no known contraindications to either drugs, other than hypersensitivity, there are a number of precautions that must be considered when using armodafinil and modafinil. We got a tumbling oral contraceptive hubcap flying from that P450 truck, our recurring symbol for CYP450 enzymes. Armodafinil and modafinil both induce CYP3A4/5, thereby increasing the metabolism and decreasing plasma concentrations of substrates, including hormonal contraceptives. For patients with childbearing abilities, additional barrier methods should be used during treatment with these agents and for 1 month following discontinuation. That truck won't be going anywhere with that broken cyclosporine cyclophan. This CYP3A4/5 induction may also result in increased metabolism of cyclosporine, symbolized by our broken cyclophan. Therapeutic drug monitoring of cyclosporine levels should be conducted to measure serum levels and the dosage of cyclosporine adjusted to maintain therapeutic levels, if necessary. Remember, decreased cyclosporine levels can have significant clinical implications, especially when used to prevent transplant rejection. Let's turn our attention from our broken down truck and CYP induction to our friendly sponsors, Billboard and CYP inhibition. These agents may also inhibit CYP2C19, resulting in increased substrate concentrations. That elevated billboard advertising Friendly's tow truck symbolizes elevated phenytoin levels, and Ben's Diner, our symbol for benzodiazepines like diazepam, which may both become elevated when used with armodafinil and modafinil. Dosage adjustments of these agents may be necessary to avoid adverse effects and toxicity. Armodafinil and modafinil have also been associated with intrauterine growth restriction and spontaneous abortion, and therefore should only be used during pregnancy where the benefit outweighs the risk. Our pregnant mom here, locked out of the zoo, sad, should help you recall these potential risks. Ah, nice red mask, our recurring sketchy symbol for Stevens-Johnson syndrome, or SJS. A good warning, because both of these drugs can cause a serious rash, which can develop into SJS. Cessation of therapy at the first sign of a rash is essential, except when the rash is clearly not drug-induced, for example, due to contact dermatitis. I think that red mask might be scaring those goats into that planking state, though. If drug reaction with eosinophilia and systemic symptoms, or DRESS, is suspected, therapy must be discontinued. Our red mask-wearing zoogoer is sporting a fancy pink polka dot dress. Looking very eosinophilic, too. DRESS often presents with symptoms such as fever, rash, lymphadenopathy, and or facial swelling. Other organ system involvement, such as hepatitis, nephritis, and hematologic abnormalities may occur, with eosinophilia also often present. And a falling brain hat? Whoever is dressing this energetic zoogoer is making some real fashion choices. A falling brain hat symbolizes psychiatric side effects, including anxiety, agitation, nervousness, and irritability, which may occur, and can result in treatment discontinuation. Caution should be exercised when armodafinil and modafinil are used by patients with a history of psychosis, depression, or mania, and discontinuation should be considered if these symptoms develop. And to top off this look, a giant heart patch? I can't even with this one. Come on. Patients with pre-existing cardiovascular disease should be monitored more closely. Armodafinil and modafinil should be avoided in patients with a history of left ventricular hypertrophy or mitral valve prolapse who have experienced mitral valve prolapse syndrome when previously administered CNS stimulants. Definitely starting to feel like that zonked out parent. Need to lie down after all this activity. We've covered a lot with regard to armodafinil and modafinil, 2 agents used in the management of narcolepsy. Make sure you check out our other sketches in our Neuro and Psych chapter to learn more about drugs for all things brain-related.